Welcome back to our nursing education series on frailty. In this second lesson, we transition from the theoretical definitions of frailty to the practical skills of clinical recognition and the application of the comprehensive geriatric assessment. Identifying frailty early is one of the most critical interventions a nurse can perform. It allows the multidisciplinary team to implement targeted support before a minor health event leads to a permanent loss of independence for our older patients. Hello everyone. As nursing professionals, we are at the front line of geriatric care. Today, we will focus on honing your observation skills and mastering the tools that bring objective clarity to a patient's frailty status. By the end of this session, you will be able to recognize the physical and mobility indicators of frailty, apply the 2-week baseline rule using the clinical frailty scale, and explain how the 4 domains of CGA integrate to form a holistic care plan. Let's quickly revisit our foundation. Frailty is a distinctive state where multiple body systems gradually lose their inbuilt reserves. These reserves are the physiological buffers that allow us to recover from illness. When they are depleted, even a minor infection can trigger a sudden decline. Recognition begins with the physical. Watch for unintentional weight loss, often documented as more than 4.5 kilograms in a single year. You should also look for a persistent sense of exhaustion, where the patient reports feeling tired or drained most of the time. Reduced muscle strength is another key indicator. In clinical practice, this often manifests as a weak grip or a noticeable slowing of walking speed. If a patient is struggling to keep pace during basic mobilization, it's a sign that their physiological resilience is low. We must also monitor for functional decline. This involves observing how a patient manages their activities of daily living, or ADLs. If dressing, bathing, or moving independently is becoming increasingly difficult, it suggests their functional reserves are nearing a threshold. In acute settings, be vigilant for the big 4 red flags: sudden immobility, new or worsening confusion, which could be delirium, recent falls, and sudden changes in continence. These frailty syndromes often hide the true underlying cause of illness. While these observations are vital, we need to quantify them using validated screening tools. This allows us to communicate clearly across the team and ensure the patient's care plan is grounded in objective data. This is where the clinical frailty scale comes in. The CFS is a 9-point scale that summarizes a patient's overall level of fitness. It ranges from score 1 for those who are very fit, active, and energetic, all the way to score 9, representing individuals who are nearing the end of their life. Scores 1 to 3 represent individuals who are generally well for their age. They are independent in their daily activities, manage any chronic conditions successfully, and often engage in regular physical exercise. These patients are considered fit or managing well. Score 4 is vulnerable. These patients aren't yet dependent on others, but they often report being slowed down or feeling tired during the day. As nurses, this is our critical window for intervention to prevent them from becoming more frail and losing their independence. Score 5 is mildly frail, where assistance is needed with complex tasks like shopping or managing finances. By score 6, moderately frail, the patient needs help with both outdoor and indoor activities, including personal care and using the stairs safely. Scores 7 and 8 indicate severe frailty, where the patient is completely dependent for all personal care. Finally, score 9 is for those who are terminally ill, where our nursing focus shifts entirely to comfort, symptom management, and end-of-life care planning. A crucial rule for using the CFS: always ask what the patient's capability was 2 weeks ago. We must score them based on their recent baseline, not their current state during an acute illness, to get an accurate picture of their underlying level of resilience. Using this 2-week baseline ensures that we don't confuse the temporary effects of an infection or fall with the patient's long-term functional status. This accuracy is essential for planning the right level of support during and after recovery. Screening with the CFS is just the beginning. For a truly effective management plan, we need a comprehensive geriatric assessment, or CGA. This is the gold standard in older persons care and involves a deep, multidisciplinary dive into the patient's entire life. The CGA is a multidimensional diagnostic process. A team of experts works together to evaluate the patient's medical, functional, psychological, and social needs. The goal is to identify every treatable issue and create a unified, personalized care plan that works. The first domain is medical. This involves a comprehensive review of chronic conditions, a rigorous medication review to avoid polypharmacy, and an assessment of nutrition, hydration, vision, and hearing. We look for anything that might be impacting their overall resilience. Next is the functional assessment. We evaluate the patient's ability to perform activities of daily living. Can they manage their own hygiene? Are they safe while moving? We identify exactly where they need support to maintain their independence as long as possible. The third domain is psychological. We screen for common issues like depression and anxiety, and we assess cognitive function. Using tools like the 480 is critical for monitoring delirium, a sudden change in cognition that is a major red flag in frail older patients. Finally, we assess the social and environmental domain. We look at who supports the patient at home, their financial situation, and the safety of their living environment. This helps us ensure they are returning to a setting that can safely support their needs post-discharge. When these 4 domains are combined, the multidisciplinary team can move beyond just treating symptoms. We address the person as a whole, focusing on what matters most to them, whether that's returning home, regaining mobility, or simply maintaining their quality of life. As nurses, your role is pivotal. You provide the continuous, high-quality observation that detects changes early. You are the advocate for the patient, the primary link between the family and the medical team, and the lead in coordinating the holistic day-to-day care plan. To recap our lesson, identify physical and mobility red flags immediately, use the clinical frailty scale with a 2-week baseline for accuracy, and remember that a CGA is essential for a holistic and successful care journey for our older patients. Thank you for your commitment to excellence in nursing. I look forward to seeing you in our next session. Goodbye for now.